Eric, let's go to our data slide for today. Today we're reporting 7,790 new cases in Ohio. This is below average for the last 21 days, but it's still obviously at a very elevated level. Sadly, we're reporting 109 deaths that have been reported since yesterday. In addition, we have 431 new hospitalizations reported. That is the 10th highest of the pandemic, and 52 new ICU admissions. So while we're seeing the leveling off of the cases, we're seeing obviously later indicators, which is the deaths and the hospital admissions as well as the ICU admissions. Eric, let's go to our top 88 counties, all the counties, but in the order. And again, these are all at a very high incident level. Let's go to the top 20, Eric. And you see Wyandotte, Pickaway, Harrison, Brown, Richland. You just got to get an idea that these are spread all over the state. It just shows, how widespread the virus is. It's everywhere. It's permeated every single county. The lowest county, even in the top 20, if you go down, Williams County, it's still 9 times, which is the 20th highest incidence. It's still 9 times the high incidence level. So very high. Today, we're showing you 2 new maps. They illustrate the key measures we should be looking at each week to see how severe the spread of COVID is in the state. And let me start with this one. This is kind of a time lapse. And you'll see the key cases per 100,000 residents. Here would be 0. Over here would be 1,500. So it just shows how widespread it is. And this is kind of a time lapse starting August 1, September 1, October, November, December 1, and December 22nd. And so, what you can see is we're moving further and further this way. And basically, every county is in the red. But we designed this to really show you so that someone can look at this map and see how they compare with other counties. Again, this goes back to the data point that we just showed a moment ago that we've asked people really to look at to determine how much spread they have in their county. It's the best data point to see what's happened in the last 2 weeks, what's out there, how widespread the COVID is in your county. It's widespread everywhere, but this gives you kind of a time lapse of how this has progressed, unfortunately, obviously going the wrong way. Eric, let's look at the next slide. We've indicated there are really 2 things now to look at, now that we have spread all over the state. One is what we just showed you, which is the number of cases per 100,000 in the last 2 weeks. How much spread is there in the county? The other is to look at your hospitals, and what kind of shape they are in. And so this has been designed, COVID patients as percentage of all ICU patients. And again, you will see the progression as we move. And the darker, of course, the darkest point is 75% as a percentage of all ICU patients. So, the question we're asked, what percentage in that hospital or in the ICU are COVID patients? That's what this is showing. So again, it is what the doctors tell us and the hospital administrators tell us is the best way to indicate, how much pressure is being put on our hospitals. So again, the darker is worse. We have it broken down into the different regions, and you will see, which regions, region 7, region 8, those are the ones that now are really hit the hardest as far as, again, this is not spread, but it's ICU capacity. So we're going to update these every week, and these would be 2 maps that I would suggest that you look at every week. And Eric, let's see the next one, which is just where we are. These are the 2. This is today, or as of yesterday. Again, spread on one side, ICU, how much ICUs are being hit in our hospitals by that particular region.